You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers, cosmetic dentistry. According to my first guest, your teeth and gums are never too bad to have the smile you've always wanted. We're talking about complex full mouth rehabilitation. With us, we have the go-to dentist in Houston, Texas, Dr. Sahegin Charolia. Dr. Charolia, welcome to the program.
Thank you for having me, Randy.
They call you Dr. C? You
Dr.
say your
C.
patients Dr.
My
C?
patients and my staff call me Dr. C.
Now, give us a working definition and also tell us who's like your typical patient that you see. Working definition of these full mouth rehabilitation cases. And also what are the different services you do?
So we see patients from all walks of life. We see patients of all sorts of patients in our office.
Okay.
We do treatment on kids that range from sealants to fillings.
Okay.
We take care of the cavities for the kids. We do braces, traditional braces. We do clear aligners.
All right.
We have adult patients that come into us to get crowns, root canals done. We have other patients that come in with missing teeth that can get 1 or 2 implants done. We also do porcelain veneers. We do a little bit of sleep apnea as well.
Now, so you have this concept of doing just about everything under one roof. In fact, as you say, what would take like maybe the endodontist, the prosthodontist, the periodontist, you do all right there. And because people don't like going to the dentist.
Yes, we do. Once they go to the office, patients start trusting the staff. They know the familiar faces around the office. So we try our best to do everything in our office, like root canals. We can do root canals in our office. We can do crowns in our office. We can do implants in our office. So we try to do as much as we can in office. Now there are some tricky ones that might require a specialist, and we have some specialists that we trust and our patients like. So we involve them when we need them.
Moving into full mouth reconstruction, these extreme smile makeovers, give us a working definition, because I guess full mouth reconstruction is a dental term. So what is it?
Yeah, so full mouth reconstruction essentially just means that somebody that comes to us with bad teeth, they have old crowns,
Okay.
old bridges, they have some missing teeth. And what we do for them is we are basically rebuilding they might also have gum infection.
Okay.
And they're coming to us and we're basically treating that gum infection. We're rebuilding their smile, their teeth. We're doing new crowns. We're doing some implants. And a lot of the things that we do in our office requires trips to multiple doctors, multiple specialists, but we do it all under one roof. So we have had training for root canals, and sometimes patients have to go see endodontists. Now we will still send some with the tricky ones to the endodontist, but we can do most of the root canals in our office. We can take care of their crowns and bridges need in the office. So a lot of times patients have to go to the prosthodontist to get a new set of teeth. We can do that in our office. With the gum disease, a lot of times patients have to go see a periodontist. Now we can rebuild their gums, treat the gum infection in our office.
So like people with bleeding gums, like the bad breath, loose teeth, you guys take care of that.
Correct.
That's
Yes.
kind of what you do.
Yeah, so if somebody that has dealt with bad breath, there's this bacteria under their gums that is causing them to have this gum infection, swollen gums, bleeding gums. They come to us and we can treat that gum infection.
Now this new concept where dentists are doing everything with advanced training. I guess you're not a specialist. I even told you there's an oral surgeon that said, Randy, have you heard of these new super specialists? They're kind of all over the place now. And even though it's not a recognized specialty, but you've learned a lot of stuff. So is it really something you learn? They don't teach you this in dental school? It's all the stuff afterwards? How does that work?
Yeah, you're right. So there's a lot of times there's limited training during dental school. So after the dental school, we actually go out, and I've traveled quite a bit to get those advanced training in different procedures, like the root canal that we offer for patients. The implant procedures that we offer to patients, they all require advanced training, braces,
Okay.
and that requires those advanced training, and I've done those advanced training, so I can offer that to my patients.
What
in
about
our
wisdom
office.
teeth?
That's the same thing. With wisdom, we do that in our office as well. We offer
Because
that.
typically what, an oral surgeon does wisdom teeth?
Correct. So a lot of times patients have to go see an oral surgeon to get their wisdom teeth out under IV sedation. So we do IV sedation in our office so the patients are comfortable.
Okay.
And then they'll get their wisdom teeth out right
Are
there.
you less than the oral surgeons?
Yes, that's correct. We are going to be less expensive than the oral surgeons because we can do it right there in our office.
And you still offer the sedation, or what levels of sedation do you offer?
We offer nitrous. We offer oral sedation, which is like when they have to take a pill. And there are some patients that are really afraid to come to the dentist. We can offer them nitrous for small procedure or big procedure. So when they come to the office, they're more comfortable.
Is it easier for you as a dentist, like if somebody has a little bit of nitrous or they have a sedation pill, is it easier, or even IV sedation, is it easier for you to do your work?
Well, it's easier because the patients are comfortable.
Okay.
We had this patient that was very, very anxious before we started treating her.
Okay.
And we initially had to give her something to take before the appointment. And we worked on some treatment for a few visits. And then after that, she was actually comfortable and she didn't need any additional sedation after that.
Are you, like, when you meet a patient, and do they ever say, like, no offense, doctor, but I don't like the dentist? What do they say?
We heard that all the time. Patients, they'll come to me and they'll say, oh, no offense, but I don't like the dentist.
What do you say to that?
Well, I usually just tell them, well, I don't like patients.
So you make a joke out of it?
So I just make a joke out of it, yeah. I mean, I love my patients.
Now, do you have like a secret goal? Like you feel like you're going to win them over eventually? Like where they're no longer afraid of the dentist?
Well, yeah, I mean, I like for my patients to trust us. So we'll work, or we'll do our best to gain the trust from them. And we want to get to the point where they're comfortable coming to see us.
And I was saying that, dentists have a bad rap when it comes to suggesting things or recommending procedures that the patients don't need. Can you speak to that?
Yeah, I mean, we've heard that a lot. The patients, for some reason, think that we recommend additional treatment that they don't need. Now, the thing is, a lot of times patients come to us and we look at, so in our office, they'll come to us, they'll see us, and we will do our best to take care of the immediate concern, immediate emergency, procedure or pain that they come in with. We'll get them stable. And then the thing is, we see some additional things that we can predict that might cause you more problems down the road in the future. So it's our duty to let them know what they can do to fix that. So for example, if you have missing teeth, your other teeth start shifting. And when that happens, your bite changes. So you start noticing this pain in your jaw, or you start noticing that your teeth don't come together like they used to be.
Okay.
And we try to make our patients aware that this is what might end up happening in the future. So we recommend treatment for that.
Now, nobody likes going to the dentist, right? I mean, especially men, we wait until we're in pain before we go to the dentist. Is that typically what happens?
That happens all the time. We have so many patients that they have to be brought to the office, men that have been brought to the office with their wives because the wife has forced them to come.
They're sick of them complaining at home.
They wait till last minute.
They make the appointment for them?
They make the appointment for them. They drive them to the office. It's because they don't want to come and see us. So, we're sitting there talking to them, and the wife's sitting right there in the corner. And then they make sure that they get the work done. So they wait till the end moment until they're uncomfortable. They're in excruciating pain until they decide to take that action.
Okay, good. So you brought some photos. What are we looking at? Now, these are the full mouth extreme smile makeovers. If you're just tuning in now, we're talking about extreme smile makeovers. According to my first guest, he says your teeth and gums are never too bad to have the smile you've always wanted. Do you believe that?
I do believe that, yes. We can, any stage you're at, we can always do something to fix that problem. It's always better to take care of it sooner rather than later.
Okay.
So
let's take a look.
So this is a patient that came to us, and she's actually a relative of one of our associates. And she came to us with some concerns about her teeth, about afraid to bite into certain things. So if you look at that picture, you'll see that she has very flat, worn down teeth.
Okay.
That's actually a sign of old age. Our brain associates flat, worn teeth with older age.
Makes you look older.
Makes you look older.
Okay.
So she's a very complex case. When you pull her gums back, you'll see that she has a lot of gum infection. She has lost a lot of bone. So what happens is there's these bacteria in your mouth under your gums that release these sulfur-like compounds, and it causes you to have bad breath, which was
Is that right? Okay.
which was one of the things.
So the infection has an odor to it.
You're right. Yeah.
Okay. Okay.
So we actually had to involve a specialist in our office to treat her. So she has when we pull her gums back, you'll see that she had a lot of gum infection. It's very common.
Okay.
About 50% of people over age of 30 are dealing with this condition. That's according to CDC.
Okay.
That's 64 million people. That's a lot of people. So in Houston, if you were to fill up Minute Maid Park, NRG Arena, which is our football stadium, and you fill up all the local bars, there'll still be people outside. So there's
that many people that have like gum infection.
That's how common it is.
And it leads to losing your teeth. Is that right?
It does. If it hasn't been addressed soon enough, then that's what leads to you. That's number one reason for losing teeth.
Okay, so you had to clean up her gums. Then what?
So she comes in, she gets numb, she gets a little bit of IV sedation, and with a combination of procedures, we gave her extreme smile makeover.
Looks good.
Yeah. So if you look at that, with that you can see. Let me point out certain things to you.
Okay.
If you look at that smile, you see how we gave her rounded, nice, white, bright set of teeth.
Okay.
And if you notice how her upper teeth kind of follow that lower smile line,
Yeah.
that's all by design. That's not by accident. So all those things we take into consideration when we're doing our planning. So if you look at that picture side by side,
Okay.
wouldn't you say that she looks more attractive,
Yes.
more educated,
Yeah.
more sophisticated?
Yeah.
So that's what the smile does for you.
So I have dentists that come on the show and they say, Randy, sedation, it's not necessary. We just numb them up. With a good bedside manner, they're fine. Do you think that's insensitive to have that way of thinking about it?
Yes, I think that's insensitive. If the patient is anxious and they're nervous, anxiety is not, patients don't choose to be anxious. It's just basically
It's real.
It's real, yeah. So if the patients are anxious, I had my wisdom teeth removed, and what I noticed myself was that even though I didn't have IV sedation because my teeth were a little bit easier than they are for some patients, but even though I'm a dentist and I know what is involved to take care of that, I noticed myself getting anxious in the middle of the procedure. So I understand that patients, when they say that they have anxiety, it's real.
So even if it's just like a little nitrous or a pill or IV sedation, just takes the edge away.
Yeah, so the nitrous is kind of like your base level where it'll take the edge away. And then we can, if that doesn't work for some patients, then we can offer them a pill that they will take before the appointment and an hour before the appointment.
So you're a dentist. You probably think like the smile is the most important thing. How important is it, in your opinion?
Well, of course, I think the smile is really important. And not just because I'm a dentist. If you look at, there's been a lot of surveys done, Men's Health magazine, and a lot of other surveys that have interviewed thousands of people. They've asked them what they remember about their loved ones or people that they've met, and smile is always one of the top 3 things on the list.
Yeah, eyes, the smile, okay.
Yeah, it's right there in the middle of your face. If you think about it, 98% of your body is covered in clothing, and your smile is right there in the front of your face. A smile makes you look younger. A smile will.
How so?
Well, people with white teeth, as you age, your teeth kind of wear down. When you're younger, you show more teeth.
Okay.
So that our brain is associating worn down flat teeth with old age.
Okay.
Patients with nice white bright teeth, they tend to look younger. Like if you have a 50-year-old that has dark stained teeth and you give them 3-4 shades lighter teeth, you'll think that they look younger. So we had a patient that had some spaces in between his teeth, and he came to us with some concerns that he was just not confident to smile big. He came to us with his fiance, and we gave him a new set of veneers, and we just fixed his concerns, and he was just all smiles for his pictures. If you think about it.
So he just never smiled before.
Well, he was very afraid to show his teeth. So he would smile with trying to keep his lips covered, keep his teeth covered. And after we fixed his teeth, he was more confident.
So they give like the impression, because if you're meeting them and they're not smiling, it's like you think that maybe they don't have a personality or they're a serious person when in fact they just don't like their teeth. Is
Oh,
that happening?
That does happen. Can I give you an example?
Yeah.
Here's a picture that I want to show you.
Okay.
Now, if you look at that photo, so this is actually one of my staff member, and I just wanted to show you an example of what a smile can do for you.
Okay.
And she actually has a really good smile, but I asked them, okay, let's pretend like you're not gonna smile, and you can see in that picture that she actually looks arrogant. She looks like she's angry or she's not friendly. There's a lot of people like that walking around like that, and they look like they're stuck up or they're just not friendly.
Okay.
But in reality, they might be the friendliest person you know. So let's look at the after. Let's see what happens when she starts smiling.
So she had nothing done. This is just a picture of somebody that works with you, not smiling and then smiling.
You're right. So
Okay.
that was this all
Looks
we
different. She looks different.
did. She looks different. All we did is just asked her to smile big and show her confidence, and you can see that once you say that she looks more confident.
Yes.
And more sophisticated, more friendly.
She does.
So that's
And prettier.
and prettier.
Because you were telling me in the green room, a smile makes you look more attractive. Makes
You're right.
everyone look more attractive.
Everyone look more attractive. You're right. Like a
Well,
nice
she's
smile.
now this is an employee of yours. What does she do for you?
She's actually our office manager.
Okay, so your office manager. When she saw this photo, was she also surprised? Like
She
what the
was.
difference is?
She was. She herself said, "Oh, I look really mad in that picture," even though she wasn't. All we did was like, just don't smile.
What's it like when you fix somebody's smile, like an extreme smile makeover, really bad teeth and gums, and you give them this new smile? What's it like when they look at in the mirror for the first time?
They almost don't recognize themselves. They have been hiding their smile all their life, and then now they're just more confident. They're more vibrant. Their reactions are almost they want to hug us after the treatment. So we've had a patient just like after the treatment ask us, "Can I just hug you after I'm done?" Because this was amazing. So let me go back to your original question about how important a smile is.
Yeah.
There's another example. If you have two sisters that go or they come to you for a job interview.
Okay.
Now let's just put things, all things considered equal. Let's say they both went to Harvard. They're both educated. They're both at the same level, and they both have a little space in between their front teeth. And one doesn't really care about that and goes about her day without really considering that. And then we have the other one that is more concerned about her smile. So she's not really smiling as much, and she's trying to hide that when she's out in public.
Okay.
Who would you hire if they both come
If
to
one
you?
is smiling and one isn't, all things being equal.
You're gonna hire the one that's smiling.
Okay.
Why-
Yeah, it looks happy.
It looks happy, and not just that, because she's gonna look more confident, more well-adjusted, more friendly, because that's just good for your company.
Now, are you surprised sometimes, like you have somebody that comes in on consult, they're kind of down on their luck, very insecure about their smile. You fix their smile, their teeth, their gums. Are you ever surprised at what a big deal it is for them?
Yeah, we do see that all the time as well. Patients that have been dealing with gum infection, and so they're afraid to go close to anybody just because they're afraid about the bad breath. And we treat their gum infection, we take care of their concerns, and then they're just a different person. Now they're up close with their friends, family, kids. They're just back plugging themselves back in and with their loved ones.
You brought more photos.
Yeah, here's another gentleman that came to us.
Okay.
He had some concerns about his teeth. He had some teeth that he had cavities. He was just in a lot of pain. He had bleeding gums. He had a gum infection, and there's a lot of people out there that deal with pain, and they're just basically afraid to smile and they don't know their options.
Okay.
So he came
You
to
say
us.
sometimes they're hopeless. They're without hope. Like they don't even know what can be done.
You're right. So
that
they
right?
they don't know their options. They just go on about their life, just dealing with that pain. They avoid certain foods. They try not to eat cold food. They let their liquids come to room temperature because they're sensitive.
Okay.
They try to avoid chewing on things like salad. Now he had a flipper, the thing that comes in and out. That
Like
thing
the
is.
front teeth was flipping in and out.
You're right.
Okay.
That thing is terrible, by the way. I know you probably never had that.
Okay.
'cause you
No,
had-
I haven't.
So that thing's really hard to eat with. So of course you can't even bite into a hard food with the front teeth. You can't bite into apples. You can't bite into carrots with that. So we made him a bridge that doesn't come out. We replaced some of his old crowns that had some cavities. Now the crowns, a lot of people don't understand this, but once you get a crown, you can still get cavities underneath it. So over time, you might have to get that replaced. So we gave him brand new crowns. We cleaned up his old teeth, and
the after looks good.
And that's his after. So you see how his smile, his teeth follow the lower lip.
Looks good.
So we basically gave him rounded, white, bright new teeth that makes it look younger. Once you say that, he looks more confident in that second picture.
That's for sure.
It changes the facial structure when we fix a lot of these problems as well. What happens is over time, as you age and your teeth wear down, the distance between your nose and your chin gets smaller.
Okay.
And that's what makes you look older. So when we fix these problems, as you can see in that picture, it just makes you look younger. And now he can eat whatever he wants. He can eat salad. He can bite into that tough steak. I want to make this one more point.
Okay.
If he would have went someplace else, they would have taken all of his teeth out and gave him a set of dentures.
Okay.
Now, not at our office. We cleaned his gums up. We cleaned his
and you
teeth
saved
up,
his teeth.
And we saved his teeth. So what you see there, he has a combination of procedures done, and he still has his natural teeth on his upper.
So do you think that there's this movement where maybe and I don't want to put words in your mouth, but there's a movement toward just removing good and bad teeth and just giving people dental implants, right? Nothing against dental implants. I'm just saying that, because we've talked about this. You say that losing teeth is expensive. So in your office, I don't know if it's your philosophy or your approach, but if you could save teeth, you are going to. And with him, you saved most of his teeth. Is that right?
Yes, we did. Yes. All right, let me show you another photo that we have here.
Right.
He's actually a friend of mine, and he is a dentist.
Okay.
So he had teeth that had some spaces, the small teeth genetically, and he was just afraid to smile because he didn't want to show those small teeth and the spaces in between his teeth. And now he's a dentist, so he knows how important his smile is.
So that before photo I'm looking at, that's his smile?
That's his smile. So
he doesn't smile.
I had to force him to get me a picture where he's smiling, and that's the best he can do for us.
Is that right?
So
how are you a dentist and you can't smile?
You're right. So that's why he decided to do something about it. Now, there's a lot of people out there that smile like that, and if you run into them, you'll think that they're unfriendly or they're angry, but that's how they've learned to smile.
Okay, so he's a dentist. He goes to you, and then what happens?
So he comes to us. We decided to fix his concerns, and we gave him a set of veneers, and we closed the spaces. You'll see how those teeth are rounded, white. Now he has a nice smile. Nice smile. If you notice something like those upper teeth are following the lower lip nicely, and that's not by accident. That's by design. And now he's happy. Now he's showing his teeth everywhere. He's smiling in all his pictures. And you can see the difference.
So his patients probably say, "I want teeth like that."
I'm sure they do. Now I'm not working with him, or I'm not beside him when they do that, but I'm pretty sure they're saying that that's what they want.
So is your message, like somebody watching this, if you don't like your smile, do something about it?
That's my message. Yeah, if you're
not for everybody, right? These extreme smile makeovers. But if you have bad gums, like really bad gums, can you still do this? Can you still get veneers? Can you still do these kind of things?
Yes, most of the time you can.
You just have to clean up this infection?
Yeah,
first?
so if you have bad gums, it's probably because of the gum infection. So once we clean up the gum infection, there's a lot of options out there, and you can get that done.
Are there that many people in Houston? I think of it as a healthy place, but are there that many people that don't like their smile?
There's a ton of people like that. They don't like their smile. Now, you'll see some people that are walking around with no smile, or they're covering their smile while they're smiling. Let me show you another picture.
Okay, let's take a look.
This is another one of our patients that came in, and she came in with the concern about those front gold teeth that she's had since she was young. She decided to get them done when they were in fashion.
Okay.
So, but now she's really afraid to smile. She didn't want to show those teeth when she was at work. During the COVID time, it was very convenient.
So as like a fashion statement, she put these 2 gold teeth in the front, and then she doesn't like them, and she never smiles.
Yeah, I mean, now she's really self-conscious about it. Now she wants to get a smile that like everybody else. So what we decided to do is, and this didn't require a lot. All we did is just replace those front 2 crowns, and look at that after.
She looks like a different person.
She looks like a different person. Now she had a making of a nice smile. So you see how her teeth are like perfectly following her lower lip line. That's she had that. So all we needed to do is give her 2 crowns, and she's happy now.
You say people like wait years and years of hating their teeth before they do something about it. Was that the case with her? Like for many years she didn't like her teeth?
For many years. I think she told us that she was about 19 or 20 when she got those front 2 teeth. And this was almost
10 plus years of not smiling.
10 plus years of not smiling.
But that's a lot of people, right?
That's a lot of people.
Like this is kind of a quick fix. Like somebody watching this, the day after tomorrow they could have new teeth.
Yeah, I mean,
is that an exaggeration?
Well, I mean, she came in and this was done in one visit.
Okay.
Just on our part, it requires a little more planning, but it's a quick fix. So let's take a look at this example right here.
Okay.
Now this is another one of our staff that all I asked them to do is cover up their smile. Now you've seen a lot of...
Are there people that smile like that? Like every time they smile, they lift up their hand?
You see that all the time. When you're outside in public, if you look at somebody that's not confident, if you look at somebody that's covering their smile, covering when they're laughing, that's because they don't like their smile and they're hiding something, and that's this tells you that they're not confident.
Look at the difference. Very nice.
She didn't have anything done. She already had that smile. All she did is just move those hands, and you can see, like, wouldn't you say that she looks more happy now?
She does.
And more confident.
Yes. We're out of time. Final message to somebody watching this: really bad teeth, really bad gums. They're not quite ready for a full mouth of extractions. They've heard what you have to say, but they're still going to put it off. They're afraid to go to the dentist for whatever reason. What do you say to them?
I tell them, come in, do a free consultation, and see us. The sooner we can catch the problem, the better, the less expensive.
Okay.
Now, they might be afraid that we might be judging them why they put something off.
Does that happen? Do you hear that from patients? Like they were judged elsewhere?
We've heard that before. Patients
like lectured, I've heard.
Yeah, so we've heard that from patients. When patients come in, they tell us that they were lectured for not taking care of their condition, of their gum disease or their teeth. We don't judge in our office. We ask them to come in. We invite them to come in and see us, and we'll work with them.
I want to thank you for coming to the show. Good stuff.
Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.